Hello and welcome back. This is Dolores, Dr. Barbo from Neighborhood Connections. I'm here with Mary Claire.
Hi.
Who's accompanying me in
through this adventure through the lungs.
Through the lungs. We thought we were going to finish on part 2, but it ended up being part 3. It ended up being part 3 because in our talking about bronchitis and pneumonia and asthma, there's one big lung problem that we really haven't dealt with, maybe 2, but one that afflicts a lot of people that we see in our daily lives, no? And that's COPD.
What does that stand for?
It stands for chronic obstructive pulmonary disease. Pulmonary meaning the whole bottom structure, the bronchioles and the lungs, no? It comes from the Greek, the pneumo means air. So the part that from here down that deals with air. And it's chronic, and chronic means something that doesn't go away, that's there for a long time.
That you can't cure.
That you can't cure. And it's obstructive. It means something's blocking it. Something's blocking the air, something's blocking the movement. Okay, so chronic obstructive pulmonary disease, okay? There's 2 parts to it, and people forget that. People can have chronic bronchitis or you can have emphysema. I think people think that COPD is emphysema, but you can have chronic bronchitis. Do you remember how many months ago or weeks ago, whenever the part 1 was broadcast or you looked at it on your computers, we talked about that fact that inside those tubes there were these hairs, okay? And the hairs, the purpose of the hairs, in that they're flowing as air comes in and out, they flow in and out, is hopefully to act as a filter to catch anything that's going in. They're sweepers. And so chronic bronchitis, itis meaning inflammation, chronic being that it doesn't go away. It's not something like a viral bronchitis that's going to clear up. You're suddenly stuck. And you've got all this inflammation going on at the lung area, at the bronchial area, that doesn't let you breathe, okay? That's the chronic bronchitis. Emphysema is a whole other thing, no? Emphysema is caused by the coating, not just of the bronchioles, that would be the bronchitis part, but those balloons themselves start filling with tar and with whatever that gritty stuff. Like if you go in a smoker's kitchen, very often you can do this on the wall and you get something on your hand. That stuff is lining the inside of all those balloons. A balloon, in order to really work, has to be elastic. So it fills up with air and it goes down. It fills up with air and it goes down. Now you've got balloons that are becoming more solid. So people breathe in air fine. But the elasticity is now being compromised. So it gets bigger and bigger and bigger and bigger because the air keeps coming in, but there's no way to empty the air out. So what do you think would happen in that balloon?
Does that just die?
No, worse than that. What happens when a balloon, you blow up, you blow up?
It bursts.
It bursts.
Oh.
Okay? So what happens is, I'm going to get up and show you on the board. I never erased this from the last time. But what happens is this. You've got, this is a tiny little stem, and here's a balloon.
Okay.
And here's another stem and another balloon. And here's another stem of a whatever, and here's a balloon, okay? So you got all these balloons, you got 1 million of them. This one blows up, blows up, blows up, and bursts. Now you've got air here out in the pocket. And this one bursts, and now you've got, and then this one bursts. And so all of a sudden you got a whole bunch of air here. Every time you breathe, you get air here. But there's no way to get the air out. So the person suddenly starts getting more and more full of dead air. air that has no way to change itself and that has no way of, the body has no way of collecting oxygen from that air because all the balloons that had arteries around them are gone. So it's more the balloons of your lungs bursting and forming pockets of atelectasis, as we call them, but of dry air, of dead air, of non-usable air. And that's emphysema.
You can see that on an X-ray?
You can see that on the X-ray. And what you can see on the X-ray isn't the dead air, but you can see that the form of the lungs, instead of looking like they usually do in the X-ray, you can see them wider. You can see it's really pushing on the rib cage, and suddenly you get a sort of a box-like, and you can look at somebody and see a big, not muscles, you can see a big frame of their rib cage. Okay.
What about their chest?
Yeah, their chest looks it looks bigger. Okay, but by the time it gets to that point, this is somebody who's not getting enough oxygen because they have all these dead spaces all around, and so you'll often see them getting oxygen by nasal prongs, no? Because you can't live without oxygen.
Right.
Okay? So part of what the COPD is it's really a lung breakdown, all right, that's causing that. What do you think causes that? I mean,
causes what? The lung breakdown?
the COPD. Is there any?
Smoking, I know, causes
Smoking's
that.
the big one. One of the things that's really important to know is that there's actually more of people who are living constantly with smokers. Secondhand smoke has been shown to be, especially in kids, a real danger towards starting this early.
I mean, you could see people who develop people who develop like lung cancer or COPD, and then their partners who don't smoke will get it.
Yeah, and kids who grow up in households like that are at even more of a danger.
What about pets?
Pets too. Anybody that needs oxygen, if they're getting their balloons coated with this tar and this, then you're going to look at dangers to their breathing. Okay. So, and this can happen with smoke. It can happen with any kind of irritant. All right.
People that work with asbestos.
Yep.
A long time ago.
People with or any kind of fumes, any kind of chemicals. People work with pesticides.
Oh yeah, I bet.
Anything that irritates that to the point that they eventually can't breathe that air out.
Dry cleaner fluids too.
But the big deal is
Smoking.
we can call it whatever we want, but smoking.
Right.
All right. So it's really important. I think those advertisements that you see on television are gutsy people that have done that. That one woman that started doing that, who died, who had you could see her getting worse and worse.
Yes.
Is a real gift for people to really look at that and say, oh.
Because it's preventable.
Yep,
I mean,
it's preventable.
with smoking it is preventable.
It's preventable.
Yeah, right.
Okay. So that's what emphysema and COPD is, and the treatment, unhappily, is zilch. We can give you things that might help. If you have chronic bronchitis and emphysema, meaning both your tubes and your balloons are affected, some people use inhalers and they can get things through the tubes better. But basically, other than giving you oxygen, there's not much we can do. The other thing to know about COPD, once you've started the damage, you started the damage. You can quit smoking, and the longer you're out from your quit date, the better you're off. But to quit smoking now and 5 years later realize you have COPD, it was probably coming along. Because once that tar is in there. Oh, and the other thing, there are people who quit smoking and were doing fine while they were smoking. And then about a month later, they start having this horrible hacking cough. And they look at me and say, Dolor, I'm going to start smoking again because I can't stand this. I didn't smoke. And some of that, thanks be to whatever, now that you're not inhaling this hot smoke, your cilia, your hair on your bronchioles are starting to grow back. And as they grow back, they're luckily cleaning out the tar and stuff from your bronchioles. So of course you're going to cough up crap,
From your
especially
bronchioles,
in the
but
morning.
not from the balloons.
It's harder to do it from the balloons.
Yeah.
That once they're broken, they're broken.
Yeah.
But at least you're cleaning out your bronchioles from that, so you are going to be coughing
Eventually,
more, and that should be.
and you'll eventually feel better.
You'll feel much better.
Yeah, right.
But you got to get through that smoking, that coughing period.
Right.
Okay, that's COPD. Is there any other questions that you can think of about lungs?
What is that? Is tuberculosis of a lung disease?
Tuberculosis is a lung disease that we luckily don't see. Well, we didn't see hardly any. We are now seeing more tuberculosis for a couple of reasons. There was a time when, and I understand there's many thoughts about vaccinations, but there was a time when people got BCG, got inoculated against tuberculosis. There was also a lot more education because people had tuberculosis, and people who had tuberculosis were either isolated into sanatoriums until they got better, or they were taught about how not to give it to other people. And so it basically became a non-entity in much of our society in the United States.
What is tuberculosis?
It's an infection from a bacillus. But it goes into not just one little part of your lungs, but it goes into all of the lung area, and it can cut off all the oxygenation to you, and if you don't cure the infection, you can die. Here, we're seeing more of it now, and we're seeing more of it for a couple of reasons. One is there are more people, like HIV people, or people with chemo, that are walking around publicly, all right? But their immune system is shot. There are people with very strong meds for rheumatoid arthritis and stuff that also affect your immune system. And there are people coming into the country who were carriers of TB and didn't know it, or did know it but weren't sick with it, and who may have gotten sick because of the stress of their being refugees, or the stress of their being whatever, and tuberculosis that had been in their body suddenly got free to grow again, and they're coughing among population that has HIV, chemotherapy, or a low immune system, or a kid with leukemia that didn't know they had it, and nobody's been inoculated against TB, you know? In another country, like when I was living in Bolivia, we would get on buses where you see pictures of them hanging out the window, and would be hanging on the pole with one foot on the last step, you know, and you don't have to hold on to anything because you're, and probably everybody on that bus had been exposed to TB. All of us, because somebody with TB coughed on us. 95% of the time you got a tuberculosis bacteria in you, you did not get sick, because your immune system could fight it, and it fought it by encapsulating it with calcium. So you had like a little egg with a TB germ inside it, and you'd live and die with that TB germ inside you. If you did a skin test, you might turn out positive, but it doesn't mean you have the illness. It means that you have an encapsulated TB in you. Only 5% of people that ever got coughed on with a TB bacillus ever get sick. So all of us are running around with that. But if I get very, very ill with something, that capsule is liable to break, and I could get TB and I could give it to people around. So we're seeing TB more. I can't hear it, and this is important. When I listen to you, I don't hear, and I also don't hear those crackles we were talking about with pneumonia, because it's usually centered in one part of your lung at first, and the air goes right around it. And so I hear, it's only when you're coughing, there's something not wrong, you're losing weight, and I do an x-ray that I can see this shadow that looks like TB. And often sometimes when I see it, it's now filled the whole lung.
I have a friend whose husband has atypical tuberculosis.
I don't know what that means up here. Atypical tuberculosis might be what we're talking about, that person had TB. I mean, had the bacteria in him and it's encapsulated. And if you do a picture, you might see, like I have little white dots in 2 or 3 places that are probably encapsulated
Okay.
TB stuff. No, but I'm never contagious. I've never gotten sick. I've been pretty sick with other stuff, and it hasn't ever broken open.
Okay.
No, but that might be what that is.
I think you're right.
There are atypical myoplasmas, there are atypical pneumonias, there's atypical that aren't your usual strep, like strep throat pneumonias, that might be that, but atypical tuberculosis, I don't know what that is. Maybe next time I'll have looked it up,
Okay. And
if you think of asking me.
Okay.
Any other questions?
Well, of course, we didn't talk about tumors of the lung.
Yeah, that's a big one, isn't it? And when we're talking about tumors, the word tumor means cancer to everybody that hears it, and that's not really true. Tumor means tissue that's out of place. Like this is a tumor, this little bump on my chin, which you guys can't see till you're talking to me one-on-one. It just means tissue that should be flat and isn't there. And there's benign tumors and malignant tumors, but in common whatever, we're talking all the time about malignant tumors, which are growths of tissue that shouldn't be there. Okay, and cancer of the lungs is probably one of the biggest killers that we have in our society here today. No, what do you know about cancer of the lungs? Where does it? What does it? Does it look like anything, or do you get fevers or?
No, but a lot of times it's. I understand it's diagnosed by coughing up of blood.
Right. And what happens there is, like I said, it's tissue out of place. Cancer is nothing more than normal cells. Like if I get cancer of the skin, they're just skin cells. If I get cancer of the eyeball, it's an eyeball cell. If I get cancer of the stomach, it's stomach cells. But our cells wear out. They get tired and they die. And in order to not just die little by little in pieces, they reproduce themselves before they die, no? So our skin is constantly breaking down and building up, as are the linings of our balloons in our lungs, or the linings of our bronchial tubes, or any place that cancer decides to grow. And when they're reproducing themselves, they split and multiply their chromosomes, and they do it exactly so you have 2 identical twins. The problem is, if in that moment of reproduction there is an irritant, at that moment of reproduction, there's some kind of irritation that zaps it, so that the reproduction is not identical. There's 26 chromosomes in this one and 20 chromosomes in this one. Now you've got 2 cells that when they reproduce aren't going to look quite like the others. If it really zapped it, and instead of 23 and 23 you had 2 and 44, whatever. No?
Yeah, right.
Okay, I can't forget my math, and if this is wrong, if any intelligent person is listening to me, what I just said, forget it. But the zapping of it, the trigger for that, whatever that was, the more abnormal those 2 cells are, the more monstrous they are. And that's what cancer is. It's why radiation, for instance, is dangerous, because if radiation hits you in the moment of division, it could mutate those cells into stupidity. But it doesn't, it's not like constant stuff. The reason smoking, for instance, is said to cause cancer so much, not just in your lungs, although that's primary, because that's where you start getting your oxygen from, but any cell in your body needs oxygen to keep living. So smoking actually is responsible for a lot of cancers.
Yeah, bladder cancer, I understand.
Right, okay. But go back to, and that has a lot to do with the chemicals that are in smoking, as well as the lack of oxygen, as well as, okay. But in your lungs, now you're talking about tar, you're talking about heat, you're talking about, irritation all over the place. So the chance of that being just constantly, every time you have to reproducing cells getting triggered by something is huge. And all you need to do is get 2 monster cells, and they could just take off.
Yeah, because they reproduce and reproduce more monsters, right?
Yeah. And eat up the other stuff around it. Okay.
Yeah.
So part of that problem is going to be the fact that it's growing in one place in your lung. It's growing right here. Well, when I'm listening to you, I'm listening to good old nothing. I'm not hearing rails. I'm just hearing, because all around it there's normal tissue. And this isn't making any sounds. It's not blocking anything. It's not doing anything. It's just there until it grows enough that it blocks. When I examine you, when I do your lung exam, I do two things on you. Before I'm going to listen to you with the stethoscope, I do this.
I wondered why you do that.
And I should hear a drum sound. Okay, I preferably do it on your skin, not just your clothes. And I hear a drum sound, and if I'm hearing a flat sound, and I listen with my stethoscope, and everything sounds good, but I do this again, and I'm hearing flat, I know there's something there that's not shouldn't be there. Okay, that's space filling, that's taking away the air out of that spot. And it's sometimes the way we can find TB. It certainly is the way we can find cancer if cancer is big enough to be if I happen to hit it right at a good spot,
right,
or if it's taken up enough of a lobe. No. And you probably all have seen people with you've probably all seen people with oxygen and felt bad for them with their oxygen. I just want to point out to everybody that seeing somebody with oxygen, there's a discrimination thing going on that's very hard. People don't like to use oxygen. And in public, even if they really, really need it. And some of that is because we now, in our younger generations, have been educated enough about the dangers of smoking. But when people in my generation, for instance, were growing up, everybody smoked. And we had no idea that the cigarette people were even putting more nicotine in the cigarettes so that we would become more addicted to the cigarettes. So people were smoking and getting all the process starting in their bodies. And some people can stop, and some people just can't. Some people, I have had patients that have tried 10 times, and I've been able to do it for 3 weeks, able to do it for whatever. And just like with alcohol, they might get near it and they just can't do it, and it's a real struggle. So first of all, for people who got their oxygen need by smoking, I understand there's a lot of people angry that my taxpayers are paying for your treatment of. Reality is most often we had no idea what we were getting into in our generation. No. For people who are smokers now, and we'll get it later, we can try to talk with them, we can try to do stuff, but to remember that everybody's a person. And the other deal is not everybody who is using oxygen has COPD from smoking. You can have COPD from irritants, you can have COPD from working out in the fields, from working in plumbing. You can have it from a lot of things. You could also have other illnesses like pulmonary fibrosis or autoimmune diseases that make your lungs turn to scar tissue and need oxygen. No, I have had 2 patients, actually I got a third one, who has pulmonary fibrosis who would love to run around with a sign saying, no. My partner died of pulmonary fibrosis, and we used to laugh about this. She wanted to put a sign saying, I did not, or I quit, actually, her sign was going to say the truth. I quit smoking at 11. But the reality, she said to me, in solidarity, I'm not going to do that. Because there are a lot of people out there who are getting yelled at all the time, like I am in the supermarkets and stuff.
Really?
Yeah. So be careful with each other. No, we're all working to do the very best we can. Nobody chooses to be an idiot. And once it's done, it's done. Okay? So that's what I have about COPD and about tumors.
What is pulmonary fibrosis?
Pulmonary fibrosis is usually idiopathic. Idiopathic meaning we haven't got a clue why it starts. There is a genetic component to it. There are some people whose family has that tendency to have this. But basically, your lungs, those balloons, instead of becoming harder and harder and harder because of tar or something on the inside of it, they just become thicker and thicker and thicker and fibrous. And they become full of fibrous tissue, and they no longer do this. They can't blow up, and they can't. No. So they don't burst. They just don't work, and they die of lack of oxygen. No.
Wow.
Yeah.
Okay.
Luckily it's rare. Probably in my 50-odd years of doing this, I've known for maybe 5 cases.
Is that like cystic fibrosis?
A little bit like that, and a person with cystic fibrosis, which happens to be, that's very much a genetic tendency. You form, it's fibrous tissue and there's cysts, yes, and it's called cystic fibrosis because of that. But yeah, it's fibrotic lungs, and very often, like they can do now lung transplants, as you know.
Really? No, I didn't know.
They can do lung transplants, but we try to save those healthy lungs for the kids who get cystic fibrosis.
Oh, okay, yeah.
No, so that they can grow up. Whereas giving it to somebody with pulmonary fibrosis who's 60 doesn't make much sense.
Unless you're the 60-year-old with
unless you're the 60-year-old.
Yeah.
Who may choose not to do it for that very reason.
Yeah.
No, they may offer it to you. But
yeah,
it's a choice that you and your medical people and your insurance probably people would pay, but they do transplants for that. Okay, I think we're probably winding down, and I think that really finishes lungs. I know that people have been sending in questions, and I don't know if there's any questions that you can think of.
About lungs or
yeah,
other questions?
I'm just looking at your questions.
Well, because I've been collecting these now, you know.
Yeah, I saw one down here.
One of them is, is there anything on here you want to particularly address?
No, go ahead.
Well, I thought that was kind of interesting. Why do we lose our baby teeth?
we lose our baby teeth.
Why do we have baby teeth?
Because the big teeth won't fit into our mouth.
Oh, okay, yeah, that makes sense.
And it's interesting because we were talking yesterday. We're going to go over, don't if I do this, but animals are born with teeth.
Yes.
And we aren't, no?
Right.
But we get baby teeth because we need to start chewing and using our stomachs to digest food, no? But we grow out of them. I mean, they don't fit in. And we have permanent teeth when we're born, we have permanent teeth germs already starting to grow back up here. Okay. And what happens is as we chew with our baby teeth, our other teeth are pushing against the roots, and they're pushing against it enough that they dissolve the roots, and then the teeth fall out. And
this is a crazy question. Do all of our baby teeth, I mean, we get a whole new set of teeth?
We get a new set of teeth of the baby teeth. There are some way back here that grow in once and they don't come out.
Okay, all right, okay.
But yeah, we get a whole new set of teeth. I'll tell you why I was laughing, and then we got to stop. The reason I was laughing is because we were talking about a mother yesterday who has a baby that's 3 months old and doesn't have any more milk, and she doesn't have enough milk to keep feeding the baby, and she wants to feed the baby. And I was laughing, and I said, well, what they do in Latin America is they get a kitten or a puppy to suck at the breast because they have much more suck even than a baby does, and that draws out more milk, more than your breast pump would. And I got tremendously horrible looks from the people to whom I suggested this. All right, that ends this. I promise we're not going to do any more about lungs. Our next program, tune in. I don't know when it'll be, but I have a feeling it might be on stress, or we'll see what it's on. But thank you for joining us. Thanks, Mary Claire.
Sure.